India stands at the cusp of becoming a $5 trillion economy, but there's a silent epidemic that could stand in our way: non-communicable diseases. These diseases, which include diabetes, heart diseases, cancers, and strokes, are now the leading cause of death in India, accounting for roughly 2/3 of all fatalities. Hi, I am Deepan Purival and you're watching the Savera. On this World Health Day, let us talk about the pressing issue of non-communicable diseases that jeopardizes not just the health of millions of Indians, but also the very strength and stability of our nation's economic future. Today, non-communicable diseases are claiming an estimate 5 to 6 million lives every year. What's more alarming is the fact that they are striking at younger ages. Our working age population, which is essential for India's demographic dividend and economic growth, is increasingly affected. In fact, 22% of Indians over the age of 30 are at risk of dying from a non-communicable disease before they even hit 70. Now, this is a trend we see reflected in our hospitals every month, with people in their 30s and 40s suffering from heart diseases or diabetes-related complications. This silent epidemic is not just a health issue, it's an economic one as well. The impact of non-communicable diseases on India's economy is staggering. Studies estimate that non-communicable diseases are already costing India around 5 to 10% of its GDP. A joint study by the World Economic Forum and the Harvard School of Public Health projected between 2012 and 2030, non-communicable diseases would inflict a loss of around $3.5 trillion to $4 trillion on the Indian economy. Now, this is why we need to see investment in preventive healthcare not as an expense, but as an economic strategy for a sustainable future. The good news, however, is that most non-communicable diseases are preventable. By modifying lifestyle factors like reducing sedentary habits, adopting healthier diets, and managing tobacco and alcohol use, we can significantly lower the risk. In fact, it's estimated that up to 80% of premature heart diseases, strokes, and diabetes cases can be prevented by addressing these lifestyle choices. A healthy, balanced diet, regular physical activity, and reducing the intake of unhealthy foods can make a big difference. And with air pollution being a major contributor to diseases like chronic lung diseases and heart conditions, controlling pollution should be considered part of preventive medicine as well. Regular health screenings are equally vital. Early detection can be a lifesaver. Screenings can identify conditions before they turn deadly. We also need to embrace the power of digital health technology. With over 750 million smartphone users in India, we have the potential to make healthcare more accessible and effective. From wearable devices that monitor heart rate and physical activity to AI-powered tools that predict the likelihood of diseases, we're entering a new era of health management. AI can help us assess individual health risks with remarkable accuracy and detect issues early through machine learning models. The government too needs to make strides in preventive care. Why did it take COVID to expose that the healthcare system in India is collapsed and needs revamping? And did we learn any lessons from it? Stay tuned to the Savera.